you or someone you love have scoliosis? Are you wondering what's next? What is life going to be like from now on? Or is this even a big deal? Hi, my name's Dave Butler, and welcome to the Scoliosis Experience. We are here to talk with real people, both patients, parents, and providers, to bring hope and clarity to the road ahead. Thanks for joining us, and let's get started. In this episode, I talked to Izzy, who is an amazing scoliosis patient of mine. I've known Izzy for a while now, and she has a really interesting story. Most of my patients at Align Therapy are idiopathic scoliosis, where we don't really know the cause. We kind of suspect that it's genetic or something like that. Izzy has a different cause. She has a neurological cause for her scoliosis, which makes her unique. But the other thing that makes this podcast episode unique is that she will be having surgery within the next month. So I don't know that I've had a podcast episode with someone who's about to have surgery, so that gives her an interesting perspective on scoliosis and scoliosis surgery. So she's looking at having VBT surgery, and she's had some struggles lately with getting insurance to cover this. Her parents have had struggles with that, and it's been delaying her surgery. And as you know, with VBT surgery is time sensitive. It has to be done while the child is growing, so that makes it kind of stressful for their family. This would be a great episode for anyone who is about to have surgery or anyone who's been braced or currently braced. Izzy was braced for a long time, and she gives some good advice on how to do that well and how to be consistent with it. Her mom, Julie, gives us some good advice on how to be consistent with doing the things at home that need to be done. And this is a great episode just to hear Izzy's story. She's an amazing girl, and I'm really honored to have been able to know her for a while and work with her on her scoliosis. So here's Izzy. Well, welcome to today's episode. I'm sitting here with Izzy, who is one of my amazing scoliosis patients. I've known Izzy for, actually, I didn't look this up,
5 years?
4 or 5 years?
4 or 5 years. Yeah.
So first time I saw you, Izzy, you were a little smaller than you are now.
Yeah.
And so introduce yourself a little bit. Kind of let whoever's listening know who you are.
I'm Isabel Perea, and I'm 13, and I was diagnosed with scoliosis when I was 8, and a Chiari when I was 8.
Okay, so 2 different diagnoses. And we'll talk more about that. Well, let's talk more about that right now. So what was kind of your first memory or experience with scoliosis? Kind of run us through the process where you were diagnosed with that, and yeah, go.
I remember when I was 8 and my elbow started hurting, and I told my mom, and she just told me that she tells me that I was growing, but this time she actually took me to the doctor, and then it was starting to hurt really bad, and he just took an x-ray, and he saw my spine in the x-ray, and he was like, that's not good. And so then he brought me back to my pediatrician, and then sent me to the orthopedic surgeon, and then I can't really remember how I got diagnosed with Chiari.
What happened was, I'll kind of pick up here.
Oh, this is Julie, Izzy's mom. I forgot to introduce you, Julie.
That's okay. So he noticed when he had her bend over and touch her toes that her right side had kind of a large lump to it. And so we could tell that she had scoliosis, but then Dr. Smith did this thing where he runs his pinky down her stomach, and he went on the left side and it twitched, and when he ran his pinky down the right side of her stomach, it didn't move like it's supposed to. And so he kind of did a few more tests and realized that she had a Chiari Malformation that was causing the scoliosis.
So at the time, you didn't know what a Chiari Malformation was, right?
Nope.
Can you explain it to those who don't know what a Chiari Malformation is? Or your mom can explain it.
So what Dr. Smith told us was basically her brain stem was kind of being pressed down into her spinal column and was causing compression with the spinal fluid, which was creating a syrinx. Mm-hmm. And with that pressure, it was causing her spine to curve, which typically doesn't happen with the everyday person. You don't have that curvature because we don't have that that compression in our spine. And so what he said was we were in to see him on Friday, and he said on Monday of that next week she was going to have the Chiari Malformation decompression surgery. And I remember just asking him if there were any other options that we could do. And he said no, that we had to have the surgery. And that typically the surgery, once they decompress the spine, that the scoliosis would sometimes start to correct itself. And so we went in on that Monday, and she had the Chiari decompression. And yeah.
So if we back up a little bit, Friday was the diagnosis.
Mm-hmm.
Monday was brain surgery.
Yes.
That's fast.
Yes.
Izzy, tell us about that. How did that go? Were you just kind of like, what is going on, or what?
Yeah, I was sitting in the doctor and I was like, I have no idea what they're saying. And then when we finished the appointment, Mom explained it to me, and I was like, oh wow, this is really serious. And then I didn't have to worry about school because it was during the summer, thank goodness. And then on Monday, we got ready for surgery, and then we went to primary children's, and it all happened really, really fast.
Really fast. So you came out of surgery, and, well, you probably don't remember coming out of surgery, but
No.
Tell us how recovery was. Dr. Smith, it sounds like, had said it's possible that the scoliosis would go down after the decompression. So tell us how recovery went and how all that follow-up was.
My recovery did not go pretty well. I was in the hospital for like 3 days after my surgery.
4 days.
4 days. And just like the typical watching TV and recovering. But then we went home, and I started having these really, really bad headaches. And we went back to the hospital, and he said I had chemical meningitis.
Yes. So we ended up taking her to the ER, every week. She would end up back in the ER. She would get really bad headaches, just like migraine, 100% right away. And she'd be throwing up. And so we'd take her to the hospital, and they couldn't figure out what was going on for a couple of months. They put her on a steroid, and she did that for a couple of months. And then finally they decided to do the spinal tap, and her spinal fluid came out copper colored. And so they realized that there was a small hole in the lining of the brain that they had opened up to do the surgery. And then when they sealed it, a small hole had formed. And so it was pouring brain fluid into her spinal fluid that was causing like a chemical meningitis. And so what they said was, we have to see if the hole in the lining will seal itself. And if it doesn't, they would have to go in and do the decompression again. Just not as severe as the first time. And lucky for us, the day that they were supposed to do it, all her symptoms went away. And it appears that the hole in the brain lining sealed itself.
It was a long few months, it sounds like.
Oh, yeah.
Yeah. I mean, those headaches don't sound like your typical just a little headache.
Nope.
It was like your head wanted to explode.
That's exactly right.
Yeah, kind of crazy. So, headaches went down. I forget, was that around the time when I first started seeing her, or was that later?
Yeah, we started seeing you probably that fall, right after that summer. So probably about 6 months after the surgery.
Yeah, so she had the surgery, decompressed, and the scoliosis was, I forgot if it changed after surgery. Can you tell us about that?
He did not see a significant decrease in the curve. And she was probably around like 36 degrees, 35 degrees at the time of surgery. And when we went back for the 6-month follow-up, it was still holding about 35 degrees.
So it hadn't increased, which is good, but it also hadn't decreased with surgery. So, so then I got to know you, Izzy. We worked with you on a few different things. Tell us kind of how that went. What was your experience with being treated for scoliosis conservatively at my clinic?
Dr. Smith sent me, we went for our 6 month, not right after my surgery, but like a year after. And he was like, so your scoliosis has gotten a little bit worse, so we're going to send you to physical therapy to see what we can do. And then he sent me to you.
Right. You got it. How did those sessions go? I mean, I know how they went because I was there, but can I tell people what your experience was with those?
I definitely didn't realize how weak my back was. When I first went and I was doing my exercises, I was getting so tired and my muscles were very, very worked. And like they've never been worked before.
Like they've never been worked before. I love that. So we worked on strength. We worked on correction of the curve as best we could using the Schroth method. I mean, I forget how long went by before bracing became part of the picture.
I think when I was like 10, it happened.
You're 10?
Yeah, I think they started talking about bracing about 10. And then when she turned around 11 is when he said, okay, it's time. Because at that point, we weren't seeing any decrease in the curve. And it actually was kind of getting a little bit worse. She was probably at about 37, 38 degrees at the time he decided to start bracing.
Right. So it's getting worse. You got this awesome brace that you love so much.
Totally.
Tell us about bracing. I have a lot of patients and a lot of people who listen to this podcast that may be braced or looking at being braced. Tell us how that experience was.
When I first got fitted for a brace, it was really cool though, because he would like put tape around your like core and then he would like scan you. And it was really cool. And then when I got the brace and I first put it on, and you start at like an hour and then you gradually get up to 16 hours. And I remember getting to like 4 hours and I was like, I don't know how I'm going to last 16 hours in this. Right. And I was laying on the couch and I was dying. But as you get used to it, it's not too bad. But I feel like some days it's way worse than others. And it just feels weird because it's in a position your back's never been in, which it should be in, but it's not. And so it feels really uncomfortable. And the first couple nights, it's hard to sleep in.
Right. So could we say that bracing kind of sucks?
Yeah, for sure.
We want this to be real here. Because, bracing kind of sucks, right? It's uncomfortable. Sleeping's uncomfortable. You have to get used to it. That first visit sounds like it was kind of cool. You were excited. You're like, ooh, look what he's doing, and then you get into wearing it and all of a sudden it's like, oh, the cool factor kind of wore off.
Yeah, you're excited about like picking your design and then you get it and you're like, oh, this kind of sucks.
So how long were you braced?
Was it about 2 years?
Yeah, we were just about at 2 years that she was wearing the brace. And when we would do the in-brace x-rays and even the out-of-brace x-rays, her curve had corrected in the brace about down to a 17 degree, and out of the brace she was right around about 22 to 25 degrees.
Yeah, so it was doing pretty well. So then what happened?
Go ahead.
Oh, then my brace stopped like fitting and he was so busy that he couldn't get us in, so like 6 months went around,
but then
moved. Oh yeah, we moved, so we couldn't go in to see him. And they were like, your back shouldn't have gone this worse in the past like 6 months to a year. And so then I stopped wearing the brace and they did x-rays and then we went to our appointment and they were like, you're going to need surgery.
So she had stopped wearing the brace for about a month because she outgrew it. And we had moved and we were trying to get into the clinic down in Arizona and couldn't get an appointment when we needed it. And so we ended up deciding to move back and scheduled her appointment with Dr. Smith this last December. And her curve in a month went from the 22 to 25 degree back up to 38 degrees in just a month.
It's a pretty significant change in just that short of time.
Mm-hmm.
So your curve just wanted to be at that degree, I guess.
Yep.
Yeah, sometimes, we call scoliosis different things based on what's causing it. Idiopathic scoliosis, we don't know what's causing it. Yours is not idiopathic because it's a neurological condition that was causing the scoliosis. So it's interesting, they kind of behave differently sometimes. And just that little brace holiday for a month.
That was awesome.
And that was awesome. That was awesome. So they said you needed surgery. What degree did it go to? Do you remember?
48, was it? And now we're at 53.
And we're at 50 now.
Oh, yeah.
So it went to 48. You're at 50 now. How long ago did they say you needed surgery?
8 months ago?
Yeah, March of 2020, of this year.
March of 2020.
Of 2021.
Or 2021.
Yeah.
So earlier this year, they said, okay, you need surgery. And what kind of surgery?
VBT surgery.
So vertebral body tethering, which we actually have a podcast episode about from Dr. Smith, that if anyone's wondering about VBT surgery, they can go and listen to that. But it's not a fusion. It allows for flexibility, and it helps correct the curve as you grow. A little Cliff Notes version of what that is. So why didn't they do it 8 months ago?
Because our insurance denied it multiple times.
Right. And that's the struggle we've been having for the last 8 months, right?
Yes.
So insurance has been denying that they'll cover that, and the battle has been going on for the last 8 months.
Yes, it has.
Which is crazy. So, tell us how that's been. Has that been discouraging? Has it been... tell us how that's been.
It's been really frustrating because my back's been hurting, obviously, because it's moving and shifting. And you just want to have it because it's already been 8 months. And I've been ready for a long time. Yeah,
and I remember at first, you struggled with it. You struggled with, not the diagnosis, you are diagnosed, but when Dr. Smith talked to you about surgery, you really struggled with that. And then we got to a certain point where you were ready for surgery.
Yeah.
And then we couldn't do surgery. And then we got it approved for surgery. And then what happened, Julie?
So they said it was approved, and then came back and said, oh, just kidding, that was a different patient. That was not you. And the insurance has refused to do a peer-to-peer review with Dr. Smith for the last couple of months until yesterday, when we got an email that said they will now agree to do a peer-to-peer review and hopefully be convinced that this is not an experimental surgery. This is a surgery that has shown to be successful. And if Dr. Smith can just convince them of that, we can go forward hopefully in the next couple of weeks.
So, one way or another, you're planning on in the next couple of weeks doing this surgery. So maybe they heard we were doing the podcast and they're like, oh, we better do a peer-to-peer.
Yeah, exactly.
Probably not. That's probably not what happened. But that's got to be frustrating. I mean, you gear up for it, and then they say no, and gear up for it, and they say no. So, and meanwhile, we have a window of time where you're growing, and that's when VBT will be helping. So, this is one of those that's a little more time sensitive. Sometimes with my patients who have surgery, it's not time sensitive. They can do fusion, when they choose. But with you, Izzy, this is time sensitive.
Yes.
So going into surgery, I don't think I've done a podcast episode of someone that's, right before having surgery. What are your thoughts? What are your fears? What are your concerns with surgery?
When I had my last surgery, he was like, there are some risks, and then we never really went over them because he thought that it was impossible and could never happen. But obviously it happened, and it was pretty scary. So now I'm wondering, what if there's stuff he's not telling me again? And so I feel like I always get a little nervous before having surgery because of my Chiari surgery. So but I've had 8 months to prepare, so I think I'm pretty ready.
Yeah, mentally you're probably in a better place than if you had done it 2 weeks after he said you needed surgery.
Yeah.
Right? But yeah, this isn't your first major surgery, and yeah, I bet it is concerning because you did have a few months after the last one that you struggled. So, Julie, what are your thoughts? Going into surgery. Tell us about that.
I feel like having this be her second major surgery, I'm a little more mentally prepared for the, things that can happen afterwards. I'm not quite as nervous this time, only because I know Dr. Smith knows what he's doing. He's very successful at doing the VBT surgery. I think by now she'll be his 10th patient maybe. And so I also feel like I know that I can ask more questions. And I don't think people realize that the first time it was so quick and so fast, we didn't have that time to really ask the questions we needed. And now I'm realizing that there's always time. And don't be afraid to ask questions, and ask lots of questions, and ask what, side effects could come from recovery and different things. And to listen to your child when they're not feeling well, that it's okay to go to the hospital 50 times if you have to, because you want to make them feel comfortable and know that everything is okay that way. So yeah, I'm nervous but excited for it to happen because we are running out of time and I want it to get done.
Right, the urgency is there, and it's time to do it.
Yeah.
So and I think great advice. Ask questions. Get clarification on things, because I totally agree with you. I get the feeling that a lot of times it's kind of rushed through that pre-op appointment and things like that, and you just kind of go into it without getting your questions answered. So whether that's asking questions to the surgeon, whether that's asking questions to a PT that knows about scoliosis, whether that's asking questions of other people who've gone through it, I think all those things are helpful.
Yeah.
Izzy, do you know many people with scoliosis?
My sister's coworker has scoliosis, and she just got a fusion, and she's doing really good.
Have you talked to her about surgery and that?
Yeah, I talked to her before, and she was really nervous because it went by really fast. But now she's doing pretty good.
Yeah.
And then
That's
my
good.
friend that saw you, she just had rods, and she's doing good.
So you know a couple of people that have had or are having scoliosis surgery. So I think that's helpful. Do you feel like that's been helpful to know people that are going through what you're going to be going through?
Yeah, I like relating to people and I don't know, just talking to them if I have any concerns. Because sometimes you have a doctor that probably hasn't had the same surgery that you had. So he doesn't really know exactly what pain you're going to feel. But when you have somebody that's gone through that, you know what pain they're going to feel. And
exactly,
it's just really relieving.
Yeah, it helps to ease your mind a bit. And one thing, Izzy is one of our top subscribers to our podcast. Was that helpful to hear other people's experience with that?
I liked knowing that I'm not the only one that's going through this. There's many other people that are, and it's relieving to know that I'm not all alone.
Yeah, your situation is a little bit unique with Chiari and what you've already gone through, but scoliosis is something that many people have gone through, and you can find support with them. So what would you say your biggest struggle with scoliosis has been? We've talked about, surgeries, we've talked about bracing, we've talked about all that stuff. What's the biggest struggle you feel like you've had with scoliosis?
I think probably the pain, when I'm sitting in class and I have to go for a walk because my back's hurting from sitting too long, or not being able to sit on the floor. When we're doing activities, I have to sit in a chair because my back can't sit on the floor, and just having to get special treatment sometimes has been difficult.
Yeah, kind of the hardest thing. And we've been fighting back pain for a couple of years.
Yes.
And part of that, I think, is because the scoliosis has been progressive, but part of it is just the posture that it puts you in. It just can't tolerate those.
Yeah.
So that's definitely a struggle. Julie, same question for you. What has been the biggest struggle with, other than insurance in the last 8 months?
Yeah.
I know that's probably on the top of the list. What's been the biggest struggle with the diagnosis of scoliosis?
A lot of it for me is the uncertainty. Having these surgeries and expecting things to go one way and having it go the other. I think I kind of went into it thinking after the decompression that the scoliosis would kind of correct itself on its own. Not perfectly, but maybe either hold at the degree she was at or get a little bit better. And so when that did not happen, just facing those next steps, going into physical therapy and having her, have these different exercises that she needs to do and learning a different way to sit and stand. And she's kind of brought that into our family and helped all of us sit better and have better posture. So yeah, the uncertainty of it. And then just watching your child go through things and having pain, because we can't feel what she's feeling. And so sometimes you do have a tendency to not be as sympathetic because you kind of think, well, just sit up or stretch or do these different things. And I've realized that, her spine is moving, her hips are moving. And so it's pains and different things that we've never experienced. And so just having that sympathy and giving her that little bit of extra care to make her feel better, I think has just been a big change for all of us.
Yeah, and I think that's definitely something to be aware of as a parent is, your child's going through something that, well, some parents have gone through it, but the majority that I've seen, the parents haven't gone through it. And me, even as a PT that treats scoliosis all day long, I haven't ever gone through it. And so
Right.
I think that's good advice to recognize that they're going through something that we haven't. Okay, what advice would you give, Izzy, to others in a similar situation? Obviously, your situation's a little bit unique. There probably aren't a ton of kids in that same situation. But if you think about, like, this podcast, what's the takeaway that you want people to go away with from this podcast episode?
If you ever have questions, just ask them, because you don't want to, go into something without not knowing. And always try to stay positive, because it'll be over. It won't feel like it'll be over soon, but it probably will be. And, yeah.
Yeah, that's great. Stay positive and ask questions. I think those are two very good things that people can do when they have the diagnosis of scoliosis. So, Julie, for parents, what advice would you give to them? What's kind of the takeaway for you from this experience?
For me, I think physical therapy has been a huge eye-opener for me, because you don't realize how, like Izzy said in the beginning, how weak her core was and her muscles. And so as she does her exercises, she does her corrections, I think in the beginning I thought, well, we'll come a couple of times and she'll learn a few things and maybe they will help. And as we've gone through the years and have come more often, and even her coming to me and saying, hey, I need to go see Dave. I need to have an appointment. Take them to those appointments, because the exercises she's doing and the things that you have done with her and the different techniques that you've taught her have made a huge difference. Her breathing's better, her posture's better, her strength is much better. And I think all of that has decreased her pain, even though her curve has gotten a lot worse than it was in the beginning. I think she's able to handle the pain more so because she's stronger in her core. So that for me is huge. Do the physical therapy, do what you need to do. If you need to do the bracing, do the bracing. I mean, it's not fun. As a parent, you find yourself for all that time yelling at your child, put your brace on, put your brace on. And even though the physical therapist or the bracing doctors know they're not wearing it because there's a sensor inside of it, you still find yourself just, harping on them to wear it. But do all of those things that you need to, as bad as they are and as not fun as they are, they pay off in the end. Even if in the end it didn't work, there are good takeaways from it. So,
and at least you did what you could.
Yes, we did everything we could, 100%. And that's the same attitude we're taking moving forward. The insurance doesn't cover this VBT. Well, that's the next step we'll take, and it just gives you that strength to keep going. So
if we go on I guess it's not a tangent, this is very relevant, but how do you stay motivated to wear a brace or to do your exercises? It's a tough one. It's one that every scoliosis patient struggles with. And I'm trying to figure out how to crack that nut. But tell me, Julie and Izzy, what has been helpful to stay motivated? Because it's a long process, like you said. It's not just 1 or 2 visits and then you're on your way.
Yeah.
I've known you for years, and as much as you probably don't want to know me for years, we've gotten to know each other well. But what's been motivating?
Probably that your doctors are knowing, like they know that you aren't wearing your brace, or they know that you're not doing your exercises, and then they kind of scare you, I guess, to see like this could happen to you. So you like want to do your exercises because you could see what could happen to you. And so you kind of just have to follow the rules for a certain amount of time. And then when it's over, you can go back to normal.
So kind of knowing what could happen if you don't is kind of a motivator for you.
Yeah.
Okay. Julie, what about for you? What have you found helpful as a parent to stay motivated yourself and keep your child motivated with this?
I think it's kind of along the same lines. With the bracing, that if you're putting in all this time and effort and financial side of it into it, that you're kind of doing something for nothing. So when we would talk to her about different things when she was doing her bracing and letting her know, look at it as a time frame. Don't look at the huge picture. Look at time frames. So every 6 months she sees the bracing doctors and Dr. Smith. So just look at it for that 6-month period and let's see what progress you've made. And so after those 6 months and we go to those appointments and she has those x-rays, the benefits are shown. And so I think if you kind of break it down into those smaller time frames, and same with physical therapy, I look at it as, now where we're facing VBT surgery and they have to deflate a lung, taking that time to do her diaphragm breathing and strengthening her breathing exercises so that lung can recover quicker. It's just, that goal that you're looking at. So kind of set goals for yourselves. That's kind of what we've done, and doing her exercises to strengthen her core, there's less pain. And so she can see when she's doing those exercises, I do have less pain. And she feels better. So
that's motivating right there.
Oh, for sure. One
of my favorite things in the past, I'd say 6 months with you, Izzy, is that you are getting your whole family to sit up straighter. And I've noticed your posture is doing better. And I don't know, I'm still waiting for Julie's posture to catch up.
I catch myself now.
but that's good. And that's helpful if the whole family knows what's going on and can be a part of that rather than feeling like you're the only one that's dealing with stuff.
Yeah.
So, okay, any final thoughts or final words you want to share with anybody listening? No? Well, thank you for being on the podcast with me. You're one that I wanted to have on the podcast for a while.
Yeah.
And thank you for sharing your experience.
Yeah. Thanks for having me.